translational medicine. So I will try to share my screen, and I would like to ask you, Attila, whether it's good, it's visible.
Yeah.
Okay. So first of all, thank you very much for all of you attending this course, especially now it's August and it's 6 o'clock in a nice day. So most probably you could spend your time on different events, but you are here because you are interested in. And so thank you very much for your really very valuable time. So I would like a little bit summarize what is about translational medicine and what about the Center for Translational Medicine at the Semmelweis University can provide you about what has happened in the last couple of months, and finally we will tell you how you will be able to join us. First of all, what is translational medicine? If I would like to take it very briefly, translational medicine tries to use the scientific knowledge immediately for patients and for community benefits. And if I look at how medicine and scientific activity in medicine was developed in the last century, where very small amount of clinical data were available, only the doctors could use their own experience in the clinic, and those doctors who spent more time next to the bedside, they were better clinicians than those who spent many times in research or in other places. So the individual experience was the highest good knowledge to make decisions next to bedsides. Therefore, in those places which were usually at universities, where the highly qualified doctors worked, they had a good scientific activity as well. So first quality patients care was, and after science came. However, at the end of the last century and the beginning of this century, scientific activity tremendously elevated. Almost every 10 years, it's exponentially not only doubled, but 3, 4, 5 times more scientific activity came alight. And now we have huge amount of evidences in plenty of medical situation when the decision is better if you make it after the evidences were developed by scientific activity. So it's no change, because not any longer enough to be a good doctor, your patient side experience. No, you need scientific knowledge. You need to understand the scientific methodologies to be a good clinician. So I think this is a really, really big differences. And this was one of the major aim when we established the Center of Translational Medicine at Semmelweis University, to show this activity and to provide knowledge how to use scientific data in the daily practice. So this is what I just mentioned, that the doctors never seen all the patients. For example, in Hungary, there are 5,000 patients suffering in acute pancreatitis. Even earlier, when I was working at the University of Pécs, we could see only 300 patients from these 5,000 patients annually. Therefore, each doctor can see only a small amount of patients from the whole patient's population, but this was the highest level of evidence. And however, in the present, the evidences are based on many clinical trials, 10, 100,000 of patients, thousands of doctors' experience. And now we make the decision not because of your local experience, but after the scientific evidences. And if you look at about where science goes for the future, actually it's even more science will be in the daily patient's care, including genetics, including organoids and tissues obtained from patients, and artificial intelligence. And it's one of the best example like Angelina Jolie's situation when she had the BRCA mutations, and she has not even had a symptom or anything like what a doctor could recognize, and because the chance to get carcinoma, it was above 80-90%. She decided to have a mastectomy, and she came into the news and showed that yes, this kind of, based on this kind of knowledge, this is the best you can do to survive. So I think if you look at your career in the future, you must learn the scientific methodology, you must learn how to use science in the daily practice. So we have to state that there has never been such a need for innovation in medicine. And why? If we look at how we use the scientific knowledge currently in our daily practice, the result is really, really bad. For example, if you would say that, and after today, nobody can do science in medicine, you can use only knowledge, or the knowledge which have been obtained from the past. It's still the data shows you how intensively you use the scientific knowledge for community benefits. Annually in Hungary, there are 126,000 deaths occur. However, 23% of these deaths could have been prevented by better prevention. If you look at 12.6% of this could have been avoided by more effective and timely healthcare. And if you look at actually the education, the patient's lifestyle risk factors, actually even more patients live could have been avoided. So altogether, 63,000 deaths, so it's 50% of the deaths could have been avoided. If you look at COVID-19, which is a terrible pandemic disease, actually 30,000 people died almost within 2 years, not having the vaccine immediately. However, not using the scientific knowledge kills 60,000 people annually. And this is not only a problem in Hungary, but this is in worldwide as well. If we look at the European data, under 75, 1.7 per million people dies annually, and 1.2 million avoidable mortality, which means with the same like you showed on the earlier slides, if you use better prevention and more effective treatment or better education, huge amount of people life can be saved. Usually in the western part of the world, it's around 60%. However, in the eastern part of Europe, it's around 80%. But it's still a lot of people could be saved. I usually tell you about how easily science can be described. Usually, people felt in the last century that the real science is like if you do discovery science. So, if you ask any people on the street and ask how you imagine a scientist, everyone will tell you that a scientist should be in the laboratory, should be, in a pipette in his or her hand, should be under the microscope. So everyone felt that science is doing some discoveries and after like publishing it. Yes, but what's happening after that? Just discovering, for example, also an accident by a GPS or a slow traffic, it's not enough to help you which way you should go. The implementation part of the scientific activity, or other way around, healthcare delivery science, as important as the first part, because if it's missing, you will not a map. And when you are at a cross, you need to decide, go straight on, turn left, turn right, and you can make the decision if you see what you need to do. So the implementation science is exactly the same like writing a map. Should I give antibiotics to the patients or not? Should I send the patients to surgery or use conservative treatment? So we would like to see for every question, which way should I go, like an evidence. And this is what we try to teach now at Semmelweis University, this implementation part, how to use the scientific data for the patient's benefit. So there is an unmet need to translate this knowledge back to healthcare, irrespectively whether it's prevention, diagnosis, treatment, or follow-up. Therefore, our aim is to give education, scientific education for the youngsters. Of course, those who had the graduation, they can go to a PhD immediately. Those who are still at the undergraduate level, they can be project students actually with us. So here is a map about how in May and June the PhD application process finished. We actually fed around 50 PhD students to admit to the school. However, we were very, very surprised and we were very happy that around 148 applicants were for our PhD postgraduate courses. And finally, we took 81 from this amount of people. Most of them are new PhD students. They admitted directly to the doctoral school. However, we had 16 other students. 9 of them had already PhD. 6 of them couldn't be a PhD students because they came to different faculties, for example, the health sciences or the András Pető faculty, where only they had only a BSc degree or BA degree. However, we admitted them to the program as well. And even more, we had one student who already finished his PhD, but from the discovery scientific part, but he wanted to learn this kind of implementation science as well. So here is the age distribution of the PhD students admitted to the school. Most of them are young doctors, and the rest some consultant or other medical doctors. So if you look at based on the occupation, 14 of them newly graduated, so they didn't have any kind of experience as a physician. However, most of the applicants, the two middle column, which altogether around 60%, they all of them had experience as a physician. So they were even a resident or a consultant specialist, which directly show that they already recognized that without understanding scientific results, you cannot be a good doctor. So this is a good sign that those who are next to the patients care, they saw that how important it is. And of course, we are not only concentrating on the medical doctors, but we are also concentrating all the other people involved in healthcare, including dietitians, including psychologists, including physiotherapists, including pharmacologists. So all the other participants are more than welcome to enter. The most amount of PhD students came from the Department of Gynecology and also the Heart and Vascular Center, but all the other subjects ready actually and send people. And not only we get students from the Semmelweis University, but also from the hospitals nearby in Budapest. So this is not exclusively only for Semmelweis students, but if somebody is at other universities or students, they also can join us. So here is the faculty distribution of the PhD students. You can see that the Faculty of Medicine are the most amount of people admitted to the school. However, the dentistry and health sciences and also pharmacy and András Pető faculty sent students to the program. Based on the earlier scientific plan for their PhD, we decided to establish 8 categories. pediatrics, orthopedics, traumatology, dentistry, GI and endocrinology, gynecology, urology, cardiology, miscellaneous, which including plenty of small subjects. And the last two were also formed to one group, because usually one group contain around 8 to 13 students. So, however, each project can have not only a supervisor, not only a PhD student, but a project student as well. So we will have more than 80 different projects in our school available for project students. And this is the application form you saw. So I received plenty of questions that what do you need to join it? Actually, one of the most important requirements, of course, the English language skills, because all of our programs is in English. Secondly, of course, you need to be somewhere at university as a student, and you need to have protected time. So it's these kind of projects are really will be finished as projects and will be published, and there will be many papers from this. But of course, this gives you plenty of responsibility as well. So it can be feasible only if you have protected time. So we say that the minimum of 10 hours you need. And of course, it doesn't need to be this kind of 10 hours in one period. There will be courses, and you can do your own scientific activity alone. What we can give you, what will be your benefits? First, we have a professional scientific environment. What does it mean? Actually, there will be really experienced lecturers who already published several papers in the topics. We will have good consultants. We will have many multidisciplinary people, including biostatisticians, informatics, legal issues, data and patients managers. So all the other disciplines, which not about medicine, but definitely needed to get a good quality research, we will provide it for you. Of course, you will get an independent work, what you will be responsible for, and you do it alone. And of course, these kind of projects can be used for your scientific students activities like TDK activities and also diploma thesis. Of course, if you do independent work for the thesis, you will get co-authorships actually for the articles. So you not only will have thesis, but you already will have articles, which will be good enough for you to use it for PhD students. Of course, if you do an excellent performance, for example, you are a fourth year medical student and you still have 2 years, and in the first year you get excellent results. From the next year, you can be an independent researcher in the program, and you can have a first author projects in the forthcoming year. Of course, we will have very special training program, which is currently not available at Semmelweis University, and not only at Semmelweis. This is an unbelievable, new, original educational form, which currently I am not aware of any other, even Western universities who started this kind of education. And of course, you can participate on this kind of seminars, lectures, conferences, and social programs as well. The possibility of reimbursing travel expenses. So we received plenty of questions for people, students who are not based in Budapest, but also they are in medical school, either in Debrecen, Szeged, or Pécs, and they ask how they can attend. We say if they come outside from the Budapest area, from other universities, we are happy to reimburse the travel expenses for them. Of course, what can take you to get really successful? You need to be motivated, and you are because you are here and you spend your time currently, you are spending it with this program. But this is alone not enough. Of course, you need to have a commitment, because during the way of science, there will be plenty of difficulties. And of course, if you have curiosity, you have passion, you will be lucky as well, because if you work hard, luck will come for sure. So what will be the educational program? Actually, what we add plus than you can get from clinicians if you go directly to them, that usually in the past there were students and there were the clinicians, and he was your supervisor or she was your supervisor, and she teach you the subjects and also the science methodologies, partially because they didn't have really excellent knowledge in methodology. So what we can help to this team, we can help actually with the methodology. So we give you all the expertise which is necessary after a good clinical question to get the paper. And this is what I mentioned to you, that we not only have a medical group, but we will have a data management unit, we have an ethical group, we have statisticians, informatics, so all the other helps which necessary for a good quality paper. So I mentioned to you that we will have 8 different subjects, 8 different units. And all units contain people from the Center for Translational Medicine, including highly experienced specialists like, for example, me, who published plenty of good papers already. You will have scientific methodology supervisors, like they are senior PhD students who already know the methodology, they can help you. We already found the newly admitted PhD students, from them plenty of excellence students. They will also join to the team, and of course we will be statisticians. And this kind of methodology team will be next to the team who will lead the clinical parts, and you will have group leaders who are usually the head of different subjects in gynecology or urology or cardiology or the other places. There will be the senior investigators, the mentors, the supervisors for you, the PhD students called junior investigators, and each project we would like to add project students as well. Altogether, this kind of functional unit will contain 30 or 50 people, and every week you will have a 2.5 hours meeting, and this is usually in the afternoon. This is the meeting you have to attend to be part of this program. And of course, not only this kind of discussions will be available in group meeting, but all different projects where you are allocated, there will be special meetings. The first one will be a personal meeting, the second one will be via Zoom meeting. So these kind of meetings will be organized actually separately by the scientific methodology supervisors. So this is where the projects will be discussed. This will be approximately half an hour per week. So altogether, the 2 meetings will be like 3 hours. Every week we will have one day when we will have practice for the group. Of course, if you can come this kind of practical sessions, is also excellent. However, of course, we understand that you have other commitments based on your studies, but this is the other way you have. And all kind of functional unit, as I mentioned in the multidisciplinary group, will get additional help based on the topic. If you would like to start a clinical trial, there will be a clinical trial coordinators group or a register coordinators group who can help for this functional unit to act. And of course, our education is different than in plenty of other places, because we have a newly designed, innovative way of education. So we not want you to sit and get the knowledge and to be a receptor what we are saying. You will be actually one of the initiators of the studies. We want you to ask plenty of system. This is an open system, a problem solver system. the directions. We don't want to tell you which way you should push the project forward. So this is actually, I think this is the kind of education what the young people really want, to be part of the game and not just a receptor of the system. In August, we will prepare ourselves for the start in September, and there will be plenty of courses from September we are dealing with, and you can learn in August, September, October this kind of projects, and by the end of October, so in November, you already will get results what you can give in a different conferences. Actually, this kind of model were tested in Page at the University of Page. Last year there were 17, a year before there were 20 students. Now we will have approximately 81 students. We not only will teach you about the methodology, and the clinicians will teach you about the subjects, but we would like to also develop your communication skills, and we will have communication training, how to prepare a slide, a presentation, what kind of wordings it's good to use when you communicate concerning your research. So this is an additional positive issue we can add to you. And of course, how we go forward in the year, you can start additional projects with the PhD students. And of course, in the last part, it's already the time for writing articles. So definitely when you finish the year program, you will have papers as co-authors, you will have student presentations, and you can write your actual thesis as well. And of course, because I mentioned to you that this kind of education is not really available at the moment anywhere in the world, whether this is a good news or a bad news. And I must say, if I look at the acceptance of a highest level of science worldwide, I must say that this is a really very good news. We are really very proud that one of the top journals, the Nature Medicine, which is most probably the best medical preclinical journal worldwide, and provide articles only if it's original, innovative enough. They actually accept it for publication or data what we published recently in Nature Medicine, which contain all the possibilities, all the way how to bring scientific knowledge back to healthcare. So I think you can get huge amount of benefits because directly you can learn all the knowledge actually what is in front line in the world scientific scientific activity. And finally, again, the requirements not too much, I think, but definitely shows you that what is necessary to start the project. But I must say there are huge amount of benefits if you join us. So this seminar is about not only to tell you this information, but I am more than happy to try to answer the questions. First, how can you apply? We have a web page, and if you look at this web page, this is the tm/center.org and the English part. If you click on the centers, you must choose the Semmelweis Center. If you click on the Semmelweis Center, you will have this page. And in this page, if you click on the education, you can get the calendar of the program, but you must click on the application form and also the project students application, and you need to fill out everything. Of course, some of the students already know the subjects you would like to work, even gastroenterology, gynecology, you can give it at this web page. Or if you already know the PhD students or the supervisor you would like to work with, you also can add this information to us. So if you send your CV and a short CV and only a one-page motivation, we will have an entry interview at the last week in August. You don't need to afraid of this kind of interviews. We just would like to make sure that you understood everything, and if you have additional questions, you can actually answer it. So I would like to thank you very much for your time. And finally, I can see that already there are 35 students. So if you have any questions, you can put it to Q&A and you can put it to chat. I think there is already a student would like to ask, but I think there are not many students in it. So I would like to ask Attila to let enter those who have questions, so you can ask directly about anything you would like to ask. So the first question came that what do we mean graduate students? Of course, we a second year student is already good. Even if you are a first year student, this is already good. So if you are admitted to a university class, that's really enough. Is it suitable for a third year student? Of course, if you first, second, third, fourth, fifth finishing students, of course you can learn a much. You don't need to have clinical knowledge. Actually, in the system, we would like to teach you about the scientific activity, and you can learn it without currently having this kind of students. So I think many questions there are. How can I see the list of PhD doctors that can supervise us? Actually, you can go, as I showed you about the web page and the education. If you click on the education, you can see the PhD students. But you don't need definitely to actually to contact directly the PhD students, because if you just write us what kind of subjects you are interested in. It's also you can actually we can help you to find the project, so you don't need to write anybody else if you don't know yet. Does the 10 hours protected time for science include the 2 hours? Yes, I think it's also included. I mean, this 10 hours, it's not, we will not measure with the clock wise or anything else. This is the approximate time that if you don't have this time for science, I wouldn't suggest you to join the program, because if you have less time, you will cannot be followed about the scientific activity and you won't be successful. You will not enjoy it. We will not get help from you. We will not enjoy it. So the 10 hours is around the minimum number of hours you need to spend on, in which we can do research within the department without the experience in research. Of course, you are more than happy. We would like to teach you how to do research. So the question was, can we apply without any experience in research? But because there were many questions concerning where you can find actually the information. So I will immediately share my web page. So this is the TM web page. The T as I showed to you. Attila can or anyone can confirm that you can see it.
Yes, we can see.
Okay, so if you click on centers, you click on Semmelweis centers, and you click on education. Here are the academic calendar and the information booklet. If you click on the information booklet, you can see here about an introduction, and here are the different groups. Here are the name of the senior methodology supervisors, and here are the PhD students. However, this kind of list changing continuously, because we will have more students, because in August there are many others join. So here are the topics, and here are the PhD students who you will work actually in a group. But if you have no idea currently, it's okay if you just give this information to us, or if you already know that you would like to work with one of the students, it's also good. So here you can find, all the informations, the group meetings time. You can see that most of the group meetings are in the afternoon. So this will be actually easy. There are different courses. So here you can have actually a timetable for that. So it's again another question about whether is it suitable for the students to join this program without having clinical part experience in clinical part. Yes, of course, you are more than welcome. This is what we would like to teach to you. The next question is about I am currently doing TDK in other department, but can I join the project as well? For sure. If you have time for that, of course you can join, but you need to have this kind of minimum amount spending with us. So if you are a project student in other department with somebody else, no problem. You join us and you can work 2, 3, 4 different places. It's dependent really your activity and your energy level. If you are a dynamic person and you would like to show your excellence in different projects, you are welcome to come. So of course you can get the questions personally. So unmute yourself and you can ask anything if you wish. Of course, this presentation will be available on the web page, so you can find this and you look at again. If you have any schoolmates and who couldn't attend but would like to attend, you can share the web page. You can share the information, and we are more than happy to have students. We would like to have as many as undergraduate students like we have a PhD students, and hopefully we will have many. So I don't know whether anybody has any more questions. Don't hesitate to ask. If I miss your question, it's also can be helpful. So what kind of abstract presentation does the school provide? For example, all the students presenting their research at a forum. Of course, you can present your data with your PhD students who you will work with. But of course, your presentation, the PhD students will bring it to our project discussion meeting, the progress report, and of course you can take your presentation to the TDK presentation forum. But please ask personal, don't be shy. So if you have any questions, don't hesitate to ask it.
Hello. So I had one question I want to ask is that I checked the list of the PhD students
Sure.
and the specialty that I'm looking forward to is not present in these mentioned students. So is it still worth it for me to apply? I'm still going to apply, but do you think I could find
So what kind of topics you are interested in? Because we have the miscellaneous, including dermatology, including other subjects, pharmacology, and all the others. So there are these are just the main areas.
Okay, so basically I'm also looking forward to work with the Department of Neurosurgery. And
Sure.
I've already done one research paper there and I want to continue.
Congratulations.
Thank you. And do you think this is the right place for me to apply? Like, I'm still interested in neurointensive care and neurointensive emergencies. So, do you think for me it's a very narrow window, or do you think it's still worth it?
I mean, of course, we can provide. So we are not able to open actually new topics. So there will be 85 topics separately. But if you're interested in neurology, there will be definitely psychiatry topics, you will be able to join in. Of course, the best if, for example, if you work there with the PhD students and the supervisor and they would join in at a stage, it's a good one. But of course, I don't think so that we have neurosurgery specifically. But I think the main aim of this course is not for you to work in a very narrow specific field. But the main aim of this course to teach you how to do a network meta-analysis, how to design a clinical trial, how to do the registry analysis. So finally, you will have a huge amount of methodology knowledge. And I think finally the biggest advantage attending this 1 year program we provide you is not the subjects. Of course, you can change subjects in your career many times, but the scientific methodology knowledge you can learn from us. What if you would like to be a neurosurgeon at one stage, you definitely will be able to use the knowledge you gain from us.
Yes, I understand very much. Thank you.
You're very welcome. We will try. So the next question: will interviews be in person or over Zoom? We like the interviews personally, but of course, if somebody is abroad, we are happy to do it via Zoom. But the group meetings will definitely be actually personal meetings, and the specific projects meeting will be the via Zoom. So you must. Located in Budapest actually for these kind of group meetings to be able to attend the course. But the entry interview can be via Zoom if you are not in Budapest yet. So any kind of more questions? So, if there is no more question, of course, you can write emails to us at any time. This is absolutely no problem. We are happy to have your questions. And we will send you an information about where you can find this video. And after we are more than happy to have your application. I must say that you really can get huge amount of benefits from a very professional team. So we would be happy to work with you. So please apply. And if you have any questions, just don't hesitate to ask. So thank you very much for your time. And we can now close, I think, the webinar. And next time when you apply, we can meet personally. And I really do hope to meet you as many as you apply. So thank you attending. And I think we can stop the recordings. And I say goodbye.